Recording.
Welcome, welcome, welcome in everyone. Welcome to Care Concierge with CarePatrol, where education is the heart of everything that we do. We appreciate you making time today during this Friday lunch hour to join us as we will discuss choosing quality nursing home care. And before we get into this topic, and as we allow people to join us, I'll let you know that as I stepped out this morning on this cold and blustery morning, which I did not expect because it was 68 degrees last night, I realized that when we did a few weeks back a session on accepting aging, that I had left a couple of things out that I should have included. One is the day will come for you who are young when you step outside and it's unexpectedly cold. And by cold, I mean gets in your bones cold, the way it does in Alabama because it's humid, cold, and you walk into your home and you turn up your thermostat and you remain cold. And the day has come then that you know that you are getting old because you're cold and you cannot get warm. That has been my realization this morning. The other is that we also failed to include in our session some weeks ago on accepting aging, that as you get older, you become more and more obsessed with the weather. I've noticed this in myself recently. I often check my weather radar on my phone, and I will even find myself watching the weather as some of my aging clients do 24/7. And so that's another aspect of growing old, is a fixation on the weather. I also would say it's an interesting thing as you grow old to be fixated on the weather, because you, I think, realize maybe a deeper truth, an ancient truth, that we are very much affected by the weather. And it is an important thing that we neglected in our younger lives to note. So those are things, if you were with us on our presentation on accepting aging some weeks back, those two things I want to add to that in your database of remembrance of that. Today, however, we're going to discuss quality nursing home care. And you might ask, those of you who are new, oh, thank you. Bailey Wright says the weather affects mine, my sister's knees, and gives us headaches. That's how we know a storm is coming. It's arthritis. I mean, for me, I get the same thing. Thank you, Ms. Spitzer. Jasmine Connor says, agreed, and to be informed on the weather in all of your, exactly. I was looking, that's so funny you bring that up, Ms. Connor. I was looking at my wife who was scrolling. She asked last night what the temperature was, and I was standing over her shoulder and she pulled up her phone, and I thought, well, you know, it'll be right up, but it wasn't. She scrolled. I mean, she went through like 6 or 8 places. It made me wonder why is she checking those places? I mean, why does she care about the weather in Chicago? But you know, whatever, I'm just going to let that lie. Sometimes you pick your battles, but you know, it is every place of interest. You're right. It's so funny. So we'll get started. Those of you who've been with us, and I appreciate you for doing this. Some of you may not even need this contact hour, and you may not even work in any relation to nursing home care. And yet you, each of you on the call, are servants, and I think you seek knowledge for the interest and the best interest of your clients. And at CarePatrol, we're an aging care navigation service. We also seek the best for our clients, and we want for them to have the most informed, to make the most informed decision, to have as much education as we can. So in addition to all the other services that we offer, and I often think that it's maybe best to think of us like real estate agents for senior living, because we drive folks around and we're free unless, you know, we place someone, and then we're only paid by the provider. But so that's maybe a way to think of us, to give an easier sense of what CarePatrol is and what we do. Those of you who are new, those of you who've been with us, we appreciate your referrals. Those of you who've been with us know that we are password protected in our evaluation. Excuse me, let's go back. Oh, there we go. Excuse me, y'all. I was attempting to post into the chat room for those of you who are new, the evaluation link. You must do the evaluation in order to get the credit or certificate for this contact hour. And the evaluation is password protected. Those of you who are new, we give the password out at the end of the day, but we give you the link now so that you can go ahead and have it loaded and get it done. So I'm going to give you the link. Those of you who've joined us, I'm going to give you now the link for the evaluation, which will be due hopefully by 8 this evening, if you can get it done. The link for today is https://www.surveymmonkey.com/r/all uppercase letters, T as in Tom 6, T as in Tom, L 7, N as in new, Z as in Zealand. One more time, in case you're just joining us, if you need to grab some mechanism. Is anyone having trouble hearing me? Other than Ms. Goodson? I'll keep talking so you can decide. I hear you, Ms. Bright says. Thank you so much. I'm sorry for difficulties. I often think that when there are technical difficulties, they surely relate back to me. Perhaps this one doesn't. The link again, for those of you who are new, is https://www.surveymonkey.com/all uppercase letters, T as in Tom 6, T as in Tom, L 7, N as in new, Z as in Zealand. That is our evaluation. You are welcome to add your voice to mine. In fact, I would prefer it by unmuting your mics. If you're new to Zoom, move your cursor to the top of your screen or the bottom. A bar will appear. There'll be a symbol of a mic to the far left, your left, and you can click on that to unmute, or you can click in the chat room and join the discussion. But we welcome your voice. It adds to my voice, and it adds to all of our experiences. We're approved by the Alabama Board of Social Work Examiners and the Alabama Board of Nursing Practitioners to create and offer and credential this CEU. We will be uploading nursing hours to the ABNP website. Social workers, you have the ability to load your own. Everyone receives a certificate and this presentation. And on this presentation, we have 3 objectives, as we typically like to have. On finding or choosing quality nursing home care. One, we're going to list and discuss some online resources that are available to assist you. You may know these, you may not. We're going to list at least 5 and really about 25 questions to ask of nursing homes when you visit them. And then we're going to learn sort of a system overall, 4 tips. Oh, hey, Mardi Gras, happy Mardi Gras. Is that a saying? Happy Mardi Gras, Ms. Talbert. Learn 4 tips for choosing quality home nursing care. Let me move things around, excuse me. Close this, and let's go. So I'm going to ask y'all, I like to get the discussion going first and early and often. So when did you learn, or how did you learn about how to choose a quality nursing home? Were you in class? Was there a section of social work that addressed this when you were in school? Did your uncle teach you? Who tells you how to find a quality nursing home? The fact that there are no responses lets me know that this is a rhetorical question. We don't get taught this, just like we're not taught how to be parents for that matter, or how to make a lot of the big decisions that we make in life. We're not taught. We have to figure it out on our own. The one most important thing to remember about choosing a quality nursing home is not to wait until you need it. You can do some things in preparation for that so that when or if that day should come, you're prepared. So you all know, because you're all in healthcare, the nursing home industry lost 15% of its workforce since March of 2020. And if you're in case management or discharge planning, you know that there are communities now, facilities, nursing homes that will not accept new patients because they do not have the staff to properly care for them. And so when you are searching these days, that throws in a little bit of a curve into the nursing home search. What it does is increase the radius from your home as to where you may need to ultimately search to find a good nursing home. There are 15,000 nursing homes across the US. They're all short-staffed, and this has been worsened by COVID. It did not originate with COVID. And infections abound in nursing homes. COVID went wild. If you look at, for example, the deaths of COVID in 2020, I believe it was, 97% of those that were in communities were in nursing homes. I think 2% were in assisted living and 1% independent. But there was a report then in April of 2022 by the National Academies of Science, Engineering, and Medicine, and Betty Farrell, who was the committee chair, had this to say upon its release: the way in which the United States finances, delivers, and regulates care in nursing home settings is ineffective, inefficient, fragmented, and unsustainable. So then where can you go knowing this, as you do as healthcare practitioners? Where can you go to research a quality nursing home for a loved one? How do you go about this? Where do you start? Knowing that you may not know, if that makes sense. Oh, Medicare.gov. Thank you, Miss Wright. Thank you, Miss Thomas. We'll get there. We'll get there. So if you are going straight to the nursing home from the hospital upon discharge, and this will often happen that you may be given just a day or so to make that choice, then there's an organization that looks at nursing homes called the Long-Term Care Community Coalition. And their executive director, Richard Mollett, I believe is the name, recommends limiting then, in that case, your selection of facilities to those that have 4 or 5-star ratings on Medicare.gov. Now, Mr. Mollett says that the staffing measure is by far the most important and useful indicator of a facility's quality. He also says that due to the way that Medicare calculates the scoring system, that may not get the weight that it deserves. Generally now, quality scores overrule or overcome those staffing scores. Studies have shown, according to the coalition, that nursing homes should provide at least 4.1 hours of nursing care per resident per day, which would include at least 45 minutes from a registered nurse. So you can find your way backwards, knowing the number of residents, how many hours that the number of staff were allowed to give, and whether that met that standard of 4.1. But I have some issue and this is just my experience. I have not certainly as credentialed or as academic, I'm sure, or as smart as Mr. Pollock. And so I'm not suggesting in any way that I am, but I do know from experience that generally when you look at staffing scores, most communities do well. And I think it's because it's a regulation. They have to meet the minimum standard and therefore they get good rating. I think what's maybe more important is looking really for me at the quality scores and the clinical outcomes. And particularly if you're looking at rehab, then you can drill down through Medicare.gov and see the outcomes of particular types of rehab. Now, so in that way, I'm not sure that I would agree with Mr. Mollick, but I offer his opinion to you because it is a learned opinion and certainly probably trumps mine. Step one, and you all would naturally do this, you'd be inclined to ask people your friends and neighbors. You, I'm sure, would think to ask your loved ones or your own, if it were you, physician, and then it would be smart in that conversation to also say to your physician, do you currently work as medical director at any nursing homes? And then you would have some assurance, surely, of continuity of care. You could contact anyone that you feel is knowledgeable about the topics, such as a local senior center or the area agency on aging. And certainly if you're in the hospital setting, you want to be clear in communicating and asking the advice of the case manager social worker. And I know those of you who work in that milieu cannot say which nursing home is best, but I know that you can teach people what to look for and guide them towards what is best, if that makes sense. But in the end, where you want to start your nursing home search is with Medicare.gov. So Medicare.gov, if you go to the main page and there's a button there, I think it's find a provider, it may even say find a nursing home, click it, put in your zip code, and it pulls up every nursing home within you can set the radius, but let's say 25-mile radius of your home. You can then compare these by clicking up to 3 that are, for what meet whatever criteria you set, and see how they compare then in their clinical and quality scores. Just as you drill down from just 4 or 5-star ratings. The information in Medicare.gov is and clearly in no way an endorsement of any nursing home. They are simply is simply data, is simply scores, and they rank obviously information in that scoring system, and it's fairly straightforward, 1 to 5 stars, 5 being best. I show you this screen because I want you to know that if you're searching Medicare.gov and you pull up a list of nursing homes in your radius, and you come across one that has this little icon, you may not be able to see the screen, some of you on your phone or otherwise, but there's a little red icon, it looks like a little fire symbol. If you see that, you know that nursing home has been cited for abuse. That nursing home you do not select, okay? So, that's obvious, but I want to point out how to find it. Other resources in addition to Medicare.gov would be the long-term care ombudsman, and the Alabama office, and I know most of you are in Alabama, of the state long-term care ombudsman program, for which Virginia Moore Bell is the director, may be reached at 334-242-5753. These would be folks who could tell you about any complaints lodged against certain homes. You can call in Alabama, the health department and licensing agency for nursing homes is the Alabama Department of Public Health. You can reach them at the Bureau of Health Provider Standards at Alabama Healthcare Facilities Directory. Now, this is purely a directory, and you search it by county. So if you go to ADPH, you look for the page that shows a directory or facilities or something to that effect, and you can at least find the names, addresses, and names of the administrators of each of the nursing homes, as well as understand if they're owned privately or by a nonprofit or by a corporate entity, number of beds, those sorts of things, but nothing like a rating system or a guide system. You can certainly use the internet. There's plenty of good information there. I would caution you this: if you are looking on the internet and you see a listing, you search ABC nursing home and the page comes up and ABC nursing home is first, and it lists about ABC nursing home and has a photograph of it, and you click it, and then immediately you have a pop-up screen that wants your name and address and all of that. When that happens, before you put any information in, look in the address bar of the page you're on. And if it doesn't say in the address bar that it is ABC nursing home, but if it instead says something like the place for mom or caring.com or seniors, I don't know, whatever the other senior online websites are, that's not what you want to click. And here's why. When you do, every nursing home within usually 25 miles is going to be calling you, because that information that you're putting into that form is being sent to every one of them, so that every one of them then has an expectation to call you, and to call you every 2 days. This is the expectation set by the internet, right? So they monitor who they send referrals to and make them call. You'll be called by people for weeks, by as many people as get the referral. And so just be very cautious when you're searching online. Look in the address bar and make sure that it reads the same as what you thought you searched. So if you searched ABC nursing home, make sure ABC nursing home is in the address bar. And then you can ask nursing homes if they have any sort of written information on their quality of care, and you can ask for their full survey and or their last complaint investigation report. It can all be done by phone or internet. Other useful digital resources, and this one I like a great deal, is Nursing Home Inspect. Now, this is a project of ProPublica, which is a nonprofit news outlet, and they've compiled more than 80,000 nursing home inspection reports from these 15,000 nursing homes, and they've compiled them into a searchable database. And so this is a page that is sort of half, in the background of this screen is from Alabama. And there's I don't know the full name, but it's in Foley, a nursing home that has 23 total deficiencies. 11 were serious, and the fines were $20,000. So you can see then, but once you've identified on Medicare.gov what you think you may want to do, then you can search ProPublica and see a condensed and concise sense or set of their complaints and investigations and fines. And I would encourage you to do this. And then there's Nursing Home 411, which offers the same information on a state-by-state basis on staffing, citations, and ratings. And so you can augment or add to your Medicare.gov work with Nursing Home Inspect and Nursing Home 411. Now, nothing can trump this piece of visiting the nursing home. You must visit. You cannot go blindly into the night into a nursing home. You must visit it. It's a must. So we use the digital arena, Medicare.gov, 411 nursing home inspect. We use those tools to narrow down our search. We then visit. So we want to see the red. In fact, I always call it's the literal and metaphorical smell test. You open the door and there's a smell, you close the door and you walk back to your car and we go see the next place. And the reason is, and it's not any sort of, prudishness. If you have a smell in a nursing home, it is because the laundry isn't done as it is soiled, but rather on a, some days per week basis. Therefore, there's a closet sitting in that nursing home with soiled laundry from a day ago or 2 days or 3 days. And naturally, then it over time develops an odor. That odor permeates that place. It never leaves. And it is a sign, in my opinion, of just a poor management decision not to do laundry as needed. Maybe it's a staffing issue, but and that in itself is an alarm. So, not just to be humorous, but the smell test is real. It tells you a lot about the place you're looking at. And visiting allows you to ask people who are there and who work there what it's like. So before you go to the nursing home, call and make an appointment. You want to call for the admissions director. And then if you like what you saw with the admissions director, you might want to tour several places. You liked what you saw, show up again, maybe on a Saturday, maybe on a Monday at 9 o'clock. Just at random and without notice, show up and see if the place is the same as it was the day you toured in terms of your appeal. And then don't be afraid to ask questions when you go. So they'll find you, the admissions director will find you, and you'll want to ask that person and ask any staff you see to explain anything that's happening that you don't understand that may impact the care of your client, patient, or loved one. Ask who there is to call in addition to the admissions director. Ask for the director of nursing or the administrator or others in the organization. If you have questions, may you call. And then you talk to the residents if you can engage. And that's also a sign. If residents engage with you, they're in a comfortable place. But if they don't, there's something amiss in that atmosphere. If their eyes are cast down, and I understand that can be true for this person, that person, but not all people. Something is definitely amiss when you cannot engage folks. And when they engage, you want them to tell you, how do you like it here? How long have you been here? How's the food? Anything else that you may want to ask. Now, we're all Southerners, and none of us would be guilty of doing this, but you and I both know we never enter someone's room without knocking and without asking their permission. But we may want to knock and ask someone's permission because it will give us a sense of the room, of the cleanliness of the room, and of the patient area, of the objects in the room. Now, I have a question, excuse me. Ms. Goodson asked, in your experience, do various county ombudsmen typically provide information about nursing homes? Yes, that's been my experience, but you may have a different experience that you'd like to interject. And if you do, or if anyone does, again, please, at any time, don't just wait for me to ask questions with prompts. And I think I may have forgotten to do that in this presentation. I apologize, but y'all just interrupt. If you've got something to add, I'd love to hear. So you would then, as you looked in person and observed firsthand, when you look at things like cleanliness in a nursing home or in a hospital for that matter, or in an assisted living, and they have tile floors, don't look at the floors. They polish the floors to make them gleam so everything appears clean. Look at the baseboards, look at the windowsills, look at the nursing area, look in the food area. Ask to go in a room, look on the, look at the bed, look at the top of the dresser. Is it clean? Does it smell clean? And observe, are the residents dressed? Are they in their pajamas at 11 in the afternoon or morning rather? Or are they in, their clothes? And, you're going to have odors in a nursing home. So don't, that's not a reason to recoil. That is a matter of life. But I think we all know the difference between an encased odor versus a temporary smell. You also want to see what things are allowed in the resident room. So is the person or has the person hanged pictures or curtains or brought in a recliner from home? And this might be the door I would knock on, actually, would be because you can't help, and I'm not sure it's truly wrong when you're looking for someone, for a loved one doing the right thing, to look in each room as you pass. And as you do, you'll see one that somebody's got style, and you think, man, that's great. And then you knock on their door or ask permission with whomever's touring you to knock on that door and see, what's possible when you take over a room for yourself. You want to look, if you can, if you arrive at mealtime, and I would suggest you do at some point for various reasons. But one of the things you want to know is, hey, if mom has trouble swallowing or cutting her meat, do staff help? You want to make sure there's just a safety component, which will be obviously regulated and basically there. And you want to see what the activity calendar looks like. And while it may be much more sparse than one would find in assisted living, you do want to see that those activities are meaningful. And I'll tell you, there's a lady, if she's still there, at a nursing home in Birmingham, who's been the activities person, I think 38 or more years now. And you better believe that the activities that those people participate in are highly meaningful. She wouldn't still be there. She's terrific. And that exists, and you can find that. And this is even a nursing home that wouldn't be one that you might think of. And it's important. So talk to all the staff. If you're in there, try and find the activities director. They generally will come up to you if they see you. Ask to speak to the administrator. Ask to speak to the chef. Ask to speak to a CNA if you see one on the hall. When you look at a resident's grooming, don't just look at the fact that they're no longer in their pajamas. Take a look at their hair. Is it combed? Or has it once been combed, at least today? Do their teeth look clean? Do they have good dental care? Dental care is so important, especially with dementia. Are their fingernails clean? Ask if you can on one of your visits, either your initial visit or a secondary visit, go at lunch, ask if you could have lunch or taste the food. Try it, ask about the variety, look at the menu. And then also look to see how the people in the dining room interact or don't with one another, and how the staff interact and support those in the community. I'll ask a question here. Has anyone ever eaten a meal in a nursing? Has anyone ever eaten a meal in a nursing home? Amy Fuqua has. Michelle Richardson has. So how was it, ladies? How those of you who've eaten in a nursing home, what did you see what did you notice? A, was the food good? B, how were the residents in there with you? Did you feel that it was a place of care, or was it not? Ask about the activities. You'll see the activity calendar. Michelle Richardson says it was a long time ago, but I remember it being pretty good. I've eaten at a lot of these places, and food is so important. You think about it, it's 20, 3 meals a day, 365 days a year, just about, you're eating from the same restaurant. I don't care how much you love that restaurant, that's a lot. And so you want to see variety in the food. And you want to see that it's palatable, that it's good. So we don't want our loved one going in and losing. So we want to see about the activities as well. We want to see the response time. So while you're touring, there'll be a bell that rings. Look down at your watch, your phone, or look at the clock on the wall. Make note of the time. Oh, you were an employee there as well. Oh, okay. I see that, Miss Fickle. Well, yeah, because I would be eating there, because it's usually, if you're lucky, it's Good Country Cooking. If you're not lucky, it's Morrison's Cafeteria. But I'll eat both levels of food, honestly. But you observe the response times, check and see how long it is before that bell goes off. Look at your clock or watch again, phone. The activities were pretty great, says Miss Smith. They tried to keep the residents engaged. That's terrific. Activities to me are, when I look at communities with people, I tell them to focus on A, staff, or particularly staff longevity and staff turnover, and B, activity level. But response times are equally important. We want you to beware the chandelier effect. So there's some beautiful new corporately owned nursing homes that have induction cookware, granite and marble floors, and high ceilings, beautiful furniture, but they're not good nursing homes. They have terrible response times on the nursing side of the staff, not as much therapy. And I won't name them, but I'll just say that, I always advise against going there if at all possible. Now, some people, people have a free choice. But if they ask my opinion, and only if they ask my opinion, I'll say, well, look, here's what I've seen there. Here's the issues I've had reported from clients. But nonetheless, you don't have to fret that you're spending less on a loved one than the $10,000 nursing home. Because the truth is, when you peek behind the curtain of Oz, the $10,000 nursing home doesn't deliver nearly the care that the $7,200 nursing home does, right? So don't feel, I think so many times I talk with children who feel like they can't do something for mama, because they can't afford the most expensive place with the pool. But they don't realize that mama doesn't need a pool. Mama needs someone to love her, love on her, be friends with her, play cards with her. That's what she needs. She doesn't need a pool or a chandelier. Now, I would say we said at the outset of this, that because of the changes in staffing and the changes in nursing home ratings. I mean, there are 5-star and 4 stars that are now 2 stars, and it's largely due to staff. But nonetheless, we may need to increase our radius. But if at all possible, we want to stay closer to home, because we want for our loved one to maintain, or closer. Let me say this: closer to our loved ones, which unless that we have to take them to a different city where we live. But if we live in the same city, they live in one part of the city and we live in another, as long as it's not an hour away, we want to try and get them near their network, their friends who can still drive that far and visit, okay? Their churchman, their pastor, people who can assist them. people who will visit them. That's because you will visit them as a loved one. We want to keep their network. And if we can't do that, if we've got to move cities, then we definitely want to keep them near us, because the more we go, the better, not only for them and for their sense of community and belonging and having vitality left, because it's important for you as a loved one to visit. We also want to visit a lot and at different times, because we want to maintain that the quality of care that we thought we were receiving is in fact what we are receiving, whether we visit at 7 a.m. or 7 p.m. or anywhere in between. When you have someone in a home, you always want to try and have your visits alternate times. Now, don't come every day before work, because you don't know what happens in it for the rest of the day. Now, after your first visit, maybe before your second, you might want to write down your questions for your second visit. And you might want to ask, so how does the nursing home help my loved one participate in this activity calendar that I saw and spoke with the activity person about? Now, clearly you can ask them at that same time, but you want to know, hey, if my loved one is essentially bedbound, how are they going to participate in these activities? Will you somehow get them into the area? You want to ask, is there transportation? If my loved one needs to go to a specialist or needs to go to the bank, is there transportation provided? And how does that work? Does someone attend them? Do I need to meet them? How does that work? What does it cost? If you want to try and look, and I would do this on my first visit, and just see it, is there a private dining room? Is there a private den? So that if we wanted to have an 80-year-old birthday party, we could have it, with the family there on the campus. And if so, how do we get that? We certainly want to ask one of the first things, who is your medical director? Who comes here? And can we still see our doctors? And if we want to see our doctors, is there transportation and what does it cost? So when visiting, also consider these questions. Now, I said I'd give you 5. We're going to give you many, many questions. Does the nursing home make sure that the residents get preventative care, okay, like a dental cleaning, for example, or specialists like eye doctors or ear doctors or podiatrists available? Do they round here on a regular basis? Generally with podiatrists, I believe it's every either 73 or 83 days that Medicare allows for the podiatrist to, see you and pay for that visit. Does the facility make arrangements to see specialists? We've sort of hit that. And then is there a screening program? Whatever your political leaning, you want to know, does my loved one, does this potential resident need to be COVID vaccinated to be here? So just know that probably yes. And nursing homes are required to provide flu shots every year, just like COVID vaccinations. But you have, as a patient, the right to refuse these, to my knowledge. Now, someone may correct me, and I'd be happy to be corrected that nursing homes do enforce COVID vaccinations. And nursing homes, by the way, when you ask that question, you're sort of like a lawyer who doesn't ask a question unless she knows the answer already. You know that nursing homes are supposed to do this, right? They have to provide treatment or provide arrangements for you to get treatment and see specialists. So if they say, well, no, we don't do that, then you turn around and leave. Okay, because that just means they're just not right. Not right. So important things. Here's some other questions. Will the same staff be taking care of us day to day, or do they change? For example, is this person, or this CNA, is she or he on this hall all the time, or do they rotate? How will my loved one get to know the people that are caring for them? You can also look at nursing home compare for nursing. Well, I'm sorry, that's just a typo. Excuse me, y'all. And then you might want to ask, how many residents is the CNA assigned each day, day and night, and during meals? Here's Amy Fuqua. The nursing home I worked at had a mobile podiatry agency they were contracted with to visit the patients in house. Yes, most assisted livings have that as well. I assume that was a pretty standard practice among folk. You want to know, is rehab available at this nursing home? And I would say the answer would be almost 100% of the time, yes. You may only have 6 beds, or you may have, 106, but most every nursing home does Medicare rehab because it's a cash cow for them. So is there therapy here, and who are the staff? Are they employees of this place, or are they contract staff? And then, is there a dietitian, which of course there has to be, but how will they meet my dietary needs? Or my mother, has trouble swallowing, or she has arthritis such that she can't cut her meat anymore. How will you meet her needs? You haven't missed the password, Ms. King. I'm going to put the survey link in again for you to read here in the chat room. But the password will give out in just a little bit. So you also want to ask, is there oral care? We've asked that. Is there access to mental health care? So some communities will have psychiatrists who round. Does this one, do they have a section for memory care for those who have dementia? And what is the use in that dementia?
When I say I have only a short amount of time.
Got to be, turn your mic off. Let's see. Excuse me, y'all. I'm trying to fix things. Anyway, does it offer dementia care? And here's the important question. Does it use antipsychotic medication with dementia in its care? So let me see if I can see this. There we go. So the other thing you want to ask about when you're visiting the nursing home is this. Is there a resident or family council that I can attend? And there will be, and you want to then go and ask them when it's appropriate. How does this all work? Who sets the agendas for these meetings? And with the things that y'all suggest, do they get done? And how quickly do they get done? What was done in the last year? What are the plans for next year? And who does this, council or advisory group or, whatever you refer to them as, who do they report to? And how does the nursing home respond to their reports? And this would be very important for you to know that you have an engaged populace within that nursing home, and that there is attentive and accountable folks who are taking care of them. Now, step 4 is, after you've done all of these things, you visited at least twice to the places under consideration. You've maybe been to lunch, you've maybe been to a family council meeting. You've done all of these things. Then you want to do the last thing that you maybe had been doing all along, but I think you want to listen. Maybe if you're a prayerful person, you would listen in prayer, but you might instead listen to friends, family, someone like me who's done this a million times. And certainly at the end of the day, the discharge planner and social worker, if you're in that situation, those are the 2 most important people in your life for that time period. And you certainly need to communicate with them and listen to what they say. Now, you also, in step 4, in addition to prayerful consideration, this is when you look at pay. Okay. We've chosen the best option or options. Now we're going to see, can we afford them? I've listed a link here at the last page of this presentation, which you'll all get, is to the Genworth study. Genworth is a long-term care insurance company, And each year they do a study where they call into 3 metropolitan areas and ask, I think, 3 different communities or 5 what their costs are, and then they make, guesstimates based on that, and say the average cost of care in this state is this and this state is that. In Alabama, the Genworth study suggests that today, really, well, 2021, but the most recent data is that a nursing home room in our state is $7,026. I don't know of any place that would be $7,026. I think the minimum these days is about $7,250, and then you can pay $10,250 as well. But regardless, I mean, that's such a big number, right? And we do a lot of presentations on Medicaid. So any of you that are interested in Medicaid, knowing these numbers, look for us on the last Monday of this month. I think it's the 28th. Bill Nolan, who is an elder care attorney, and Pamela Strickland, who owns a Medicare assistance service, or Medicaid, excuse me, assistance program, will be discussing, and hopefully your questions. So if you have questions for Bill or Pamela, please do email them to me at sbarnes@carepatrol.com. We'd love to have those questions answered as we discuss Medicaid. Y'all know about Medicare and Medicaid. Medicare pays for up to 20 days without copay, up to 100 days with copay for rehab services in a skilled nursing facility if that patient has had 3 midnights stay in a hospital. And then they must be admitted within 30 days of leaving the hospital. And the nursing home care must be for the same, if they don't go immediately, must be for the same whatever injury, ailment, disease process they were in the hospital for. But Medicaid, is a whole different ballgame. So, and that's much more of a topic than we have time for today. But I would say this, regardless of whether you're like, if we place you in assisted living or your loved one, I'm going to tell you, hold back $30,000. Hold back $30,000. And when you get there, let's begin to look for nursing home care. At that time, you may require, or you may rather qualify medically to receive Medicaid. And so then we can look for a bed for you. But the reason we want cash is that if we go out hat in hand and say to nursing homes, we've spent all of our money, we need a Medicaid bed, and here we are. They remarkably, they don't have it when you ask that way. But when you come to them and you say, hey, we are going to be able to pay some cash privately for a little while, but we're hoping you can help us get into the Medicaid program, they will help you, right? And why, what's the difference? The difference is cash. And I'm not trying to disparage nursing homes or people who work in them, but it is about cash. And so if you go out with cash, you're much likely to be better received and find the nursing home of your choice after having done all of this study versus not. And when you go, it would be wise to go with the insurance and any other information, medical health, etc., and long-term care insurance information that you can take that with you when you visit the nursing home again, or when you begin the process of becoming a resident, and also go with 5 years of check stubs already in hand. In fact, that is what I suggest. You go with $30,000 in one hand, and you go with 5 years of check stubs in the other hand, and you're a very attractive candidate for a future Medicaid bed, because you can pay the 2 or 3 or 4 months that it takes for the Medicaid application to be completed and returned to Medicaid and processed and awarded. In Alabama, that's about a 2 to 3 month span, or it was. And so if you have enough cash in hand to cover that, they're not out their $7,000 a month waiting on Medicaid to pay them back. They have that, and then moving forward, Medicaid will take over when appropriate. That is the best way, in my opinion, to go to a nursing home. You know, cash in hand, financial statements for 5 years in the other hand. So you want to gather these sorts of information, informative pieces, including the financial, surgery, shots, allergies, those sorts of things, health problems, diagnostic tests, activities of daily living that are difficult for you, including medications. And remember, you're over the counters. Many times people forget that in a nursing home or assisted living, you need a prescription in order for even an over-the-counter medication that can be given PRN, because you cannot keep it at your bedside. We have not missed a password yet. I apologize, y'all. I'm getting to it. And I will just tell you, it's easy to remember. It's capital M, Medicare.gov. That's today's password. That's today's password, Medicare.gov. I'm typing it in to spelling it into the chat room for you. Medicare.gov is the password. There are other things, pieces of information we want to bring to the attention of our nursing home staff. Certainly family members to call, but also family members not allowed to call. And then our advance directive. So, you know, the living will does not give the family power to do anything, unlike the durable power of attorney, or certainly like guardianship. And then if you need help with those things, you can either approach the Area Agency on Aging, or again, your social worker in the hospital may be able to help. And certainly you can call CarePatrol. Here are some other resources for you. We're nearing the end of our day. Thank you for your patience. So the Administration for Community Living is a federal agency. It provides support to programs that try and maximize it. So for those of you trying not to be in the nursing home, there are streamlined access programs available through the ACL. The Elder Care Locator is the correct person to receive these. They also can help adults and caregivers connect to services, including long-term care. And then there is residents of the long-term care ombudsman, about whom we spoke. And then those of you who deal in any way with Medicare billing know about the QIOs, and KeyPro is Alabama's. And I've got a link here for Medicare to search that. And then on our resource page, we have a phone or a link for KeyPro themselves. And then this last page is just simply how to file a complaint if you're in a nursing home and you find that the care isn't up to your standard. And Ms. Tubbs says, I recently have struggled with placing a patient on Seroquel antipsychotic for sundowners. She's been taking it for about a year. It was a miracle drug for this family to control agitation, and patient is much more calm and relaxed. The nursing homes say they have to try another drug because of long-term effects. This patient is a 94-year-old hospice patient, family not concerned. I would address it with the medical director at that nursing home and with the administrator. And if I were not pleased with their answer, then I would lodge a complaint with the ombudsman. I hope that answers your question. Again, our code word is Medicare.gov. Our link is https://www.surveymonkey.com/r / all uppercase letters, J, T as in Tom, P as in Pam. Nope, I'm sorry, that's wrong. That's wrong. That's wrong. Excuse me, back up. / all uppercase letters, T as in Tom, 6, T as in Tom, L, 7, N as in new, Z as in Zealand. So I will type this in here again for you all. The Survey Monkey link is https://www.surveymonkey.com /r/ all uppercase letters, T as in Tom, 6, T as in Tom, L, 7, N as in new, Z as in Zealand. Thank you, Miss Martis. I appreciate that. Thank you, Ashley. Appreciate that. Thank you, Miss Tubbs. I have addressed DOM, but we haven't admitted yet. So Ombuzz, I think so. Yes, ma'am. I think I would ask about that, or ask the prescriber of that to maybe intercede with the medical director. That might be, a 1.5 step. You might want to try and gain more buy-in and affinity from the medical directors, the doctors. If you can get your doctor on the side of that doing that and explain why, doctor to doctor, you may be heard. You know what I mean? Angel Phillips says maybe the hospice medical director speak with a nursing home medical director. It would be true too if she were on hospice. I didn't catch that she was on hospice, but that's true. And we've had in the past, we've had Phyllis Grauer, who's a noted lecturer in hospice. She lectures annually at the National Hospice and Palliative Care Organization conference, as well as various state conferences. And she's done hospice meds for us, and she'll do it again, I hope, if she agrees in the future. She's retired now and lives at the beach. So she's hard to get to do anything, but if she'll do it again, we'll have her back. On Monday, we have Jessica Friedman of the Friedman Law Firm, who will discuss how to qualify for medical disability, or qualify for different types of disability. And then on Friday of next week, we'll have an ethics unit, which is on the social work code. So the NASW Code of Ethics, it's an ethics unit. And then on the following Monday, we have Bill Nolan and Pam Strickland, hoping that you all will have questions that you will have for them ready for us so they can answer those. Ms. Sickles, Josie says, thank you so much for this information. My husband and I dealt with his grandmother being put in a nursing home back when COVID first hit and she was out of state. So all of your questions and tips were just out of reach for us because she placed in a facility based on her fixed income. But I'm grateful to have this in my archives for future ref. Thank you so much for saying that. I appreciate that. Password for the Survey Monkey is Medicare with a capital M.gov. Thank you, Ms. Sharpo. Thank you, everyone. We're way past 4. I apologize for keeping you today. I rambled on, didn't I? I hope we see you on Monday. And y'all have a great weekend.